Hi, nurses. This is Tess. I am currently a labor and delivery nurse on the fourth floor. And as part of your orientation to the maternity unit, this educational session will focus on the postpartum hemorrhage for the nursing care of mothers with complications following birth. So this infograph that you see in front of you will serve as a quick glance to the information we'll cover today. First, it is important to discuss what postpartum hemorrhage is. It is also called or referred to as PPH. So PPH is any blood loss from the uterus that exceeds 500 mLs during a 24-hour period post-birth of a baby. After a vaginal birth, blood loss up to 500 mLs is considered acceptable. And the acceptable range for blood loss after cesarean birth is usually between 1,000 and 1,200 mLs. So approximately 1 to 5% of women will experience PPH, and it is more likely to occur with a cesarean birth. The danger of PPH is due to uterine atony, and it's greatest the first hour after birth because the placenta has detached, which leaves the highly vascular uterus widely exposed. So moving on to our number 2, the most common cause of PPH is uterine atony. And this is the inability of the uterus to contract, and it may lead to continuous bleeding. Other etiologies include retained placenta, placenta accreta, uterine rupture, uterine inversion, lacerations, retained products of conception, and maternal coagulopathy, and infection. So we refer to the 4 T's when identifying postpartum risk factors, and these include tone, trauma, tissue, and thrombin. So tone refers to uterine atony. Trauma refers to lacerations, hematomas, inversions, or rupture. Tissue refers to retained tissue or invasive placenta. And thrombin refers to coagulopathies. So there are multiple risk factors, our number 3, for excessive bleeding that you must be aware of. These include prolonged, augmented, or rapid labor, history of PPH, episiotomy, especially the mediolateral incision, preeclampsia, overdistended uterus, which could be caused by a macrosomia, twins, or hydroamnios, an operative delivery, the Asian or Hispanic ethnicity, and or an intra-amniotic infection. So identification of all patients with risk factors for PPH is essential upon admission. So moving to 4, important steps to prepare include drawing appropriate labs for all patients on admission. These would include your CBC, a type and screen on hold for medium risk patients, and a type and screen for high risk patients. And all labor patients should have access or IV access. So after delivery, each patient should be assessed for fundus firmness, so we can massage that if necessary, assess for vaginal flow, complete vital signs, and check for bladder distension every 15 minutes. The RN will document in Meditech. Notify the OB provider immediately of a boggy fundus, heavy bleeding, or clots. So interventions for treatment per provider order may include vital signs Q 5 minutes, insert a Foley catheter to empty the bladder and decrease distension, gain IV access if not already done, but it should be because every patient should have IV access, increase IV fluids to increase fluid volume, estimate blood loss in a 2-to-1 ratio without oxytocin, also known as Pitocin, fundal massage, and type and cross match 2 units of packed red blood cells. For continued bleeding, if those interventions have not worked, a second IV access will be required, stat labs with coags and fibrogen, a warming blanket placed, assess for atony, and notify the blood bank to bring 2 units of packed red blood cells to the bedside and thaw the fresh frozen platelets, and continue oxytocin. If continuing to bleed still after this point, call for additional assistance or a rapid response, and mass transfusion protocol will be initiated. In a cardiovascular collapse, if that is imminent, then immediate surgical intervention may be necessary to ensure hemostasis. Also, it's important to have access to a portable ultrasound. So upon the completion of this lesson, please refer and review the unit's policy regarding the postpartum hemorrhage. And if you have any questions, please feel free to forward those to myself or the supervisor on the unit. Thank you.